Hi there, and welcome to this exploration of a topic that sparks curiosity, anxiety, and, unfortunately, a great deal of misinformation. What constitutes a normal penis size? And perhaps even more importantly, how do you accurately measure both length and girth? This question has become increasingly common in doctors' offices, online forums, and social media, particularly with the rise in male genital cosmetic procedures. Before diving into the details, I want to offer some reassurance that might surprise you. Approximately 95% of men who worry about their penis size are actually within the medically normal range. That's right, in most cases, the concern isn't about a physical issue but rather a distorted body image. Many men perceive their size as inadequate due to unrealistic comparisons, often fueled by portrayals in adult films or online content, where exaggerated or digitally altered bodies are common. What's equally fascinating is the disconnect between men's and women's perspectives on this issue. While about 55% of men report feeling anxious or dissatisfied about their penis size, only 5 to 10% of women say they consider it a highly important factor in a partner. So, take a deep breath. My goal here is to educate, inform, and put your mind at ease by sharing real scientific data, explaining how to properly measure both length and girth, exploring the procedures available for enhancement along with their risks, and offering a historical perspective that might shift how you think about this topic entirely. Let's begin by understanding how penis size is measured correctly, as this is essential for grasping what's considered normal. There are two primary dimensions to consider: length and girth, which refers to the circumference or thickness of the shaft. Measuring penis length can be done into states erect or flaccid, and stretched, and both methods are used in scientific research. However, the most consistent and clinically reliable method is the flaccid stretch length, which closely correlates with erect length. To measure length accurately, you'll need a ruler or measuring tape. Place it at the pubic bone, right where the penis meets the body. You may need to gently press into the fat pad to reach the bone, as this ensures a consistent starting point. Then, stretch the penis out, not forcefully, but firmly while it's flaccid, and measure to the tip of the glans, which is the head of the penis. The same process applies when measuring an erect penis. Start at the pubic bone and measure to the tip, keeping the ruler aligned along the top of the shaft. It's critical to avoid measuring from the skin or from underneath the penis, as these methods can add extra length and lead to inaccurate results. Consistency and technique is key to getting reliable measurements. Now, let's talk about girth, which is just as important as length and can vary significantly between individuals. To measure girth, use a soft measuring tape or a piece of string. Wrap it around the midshaft of the penis, neither too close to the base nor the tip, and record the measurement where the tape or string meets. You can take this measurement in both flaccid and erect states for comparison, but in most scientific studies, erect girth is a standard. Many men overestimate or underestimate their size due to improper measurement techniques, or by comparing themselves in a flaccid state to others in a fully erect state, which can create unrealistic expectations. Accurate measurement is a foundation for understanding where you fall within the spectrum of normal, and it helps dispel myths perpetuated by casual comparisons or misleading media. With the measurement techniques clear, let's explore what the science actually says about penis size. A large-scale meta-analysis, which combined data from nearly 15,000 men worldwide, provides reliable averages based on rigorous research. For penis length, whether measured erect or flaccid and stretched, about 90 to 95% of men fall within a range of 10 to 16 centimeters, which translates to roughly 4 to 6.3 inches. The global average length is approximately 13.2 centimeters, or just over 5 inches. If your measurements fall within this range, you're completely normal. And even if you're slightly outside it, you're still likely within a healthy spectrum. On the extreme ends, there are medical definitions for outliers. A micropenis is defined as an erect or stretched length of less than 7.5 centimeters, or about 3 inches, while a macropenis, which is exceedingly rare, is typically considered to be above 24 centimeters, or over 9.5 inches. These cases are statistical outliers, representing only a tiny fraction of the population, so they're not reflective of the vast majority. Girth or circumference also varies, and the data shows a clear range for what's typical. For flaccid stretch girth, 90 to 95% of men measure between 8 and 10.5 centimeters, or about 3.1 to 4.1 inches, with an average of 9.5 centimeters, or roughly 3.7 inches. For erect girth, the range is between 10 and 13 centimeters, or about 3.9 to 5.1 inches, with an average of 11.5 centimeters, or approximately 4.5 inches. These numbers represent the reality for most men. Yet many compare themselves to unrealistic standards, particularly those seen in adult films. In that industry, actors are often selected specifically for their unusual size and camera angles. Lighting and editing can further exaggerate perceptions. The key takeaway is that if your measurements fall within these ranges, you're in the vast majority, even if you're outside them. It doesn't define your health, desirability, or masculinity. These are just numbers, and they don't tell the whole story of who you are or what you bring to a relationship. Before moving on, I want to address something important for anyone who's felt frustrated or embarrassed about their performance. In the bedroom, whether it's related to size, stamina, sensitivity, or desire, you're not alone. And it's not your fault. There's a simple, 100% natural remedy that has helped over 63,000 men regain confidence, restoring firmness, drive, and strength without relying on pills, injections, or risky gimmicks. It's a quick, 7-second technique you can do at home. And it works by supporting what scientists call the manhood molecule, a key trigger for arousal, blood flow, and staying power. I won't delve into the details here, but resources are available online, often through short presentations that explain how it works. If this resonates with you, it's worth exploring, as it's a science-backed approach that avoids invasive or harmful methods. Now, let's turn to a topic that's gained attention in recent years: penile enhancement procedures. It's natural to wonder if there's a way to change or improve size, but it's crucial to separate medical facts from marketing hype and understand the risks and limitations involved. One of the more common procedures today focuses on increasing girth, and the most discussed method involves injecting hyaluronic acid, a substance naturally found in the body and commonly used in facial fillers. When injected along the shaft of the penis, it can temporarily increase girth by 2 to 3 centimeters. The effects typically last 12 to 18 months. Depending on the product and the individual's metabolism, because hyaluronic acid is absorbable by the body, it's considered safer than other substances. However, not all injectable materials are safe. Some clinics offer non-absorbable fillers, such as polymethylmethylcrete PMMA or industrial-grade silicone, which can lead to severe complications including chronic inflammation, hard lumps or nodules, deformation, and even irreversible tissue damage. For this reason, these substances are not recommended by reputable medical organizations, and you should approach any clinic offering them with extreme caution. When it comes to increasing length, the options are more limited and carry higher risks. One procedure involves liposuction of the pubic area, which removes fat around the base of the penis, making more of the shaft visible. This doesn't actually increase the penis's length but can improve its appearance by reducing the fat pad that may obscure part of the shaft. Another procedure, known as suspensory ligament release, involves surgically cutting the ligament that holds the penis close to the pubic bone. This can add to 2.5 centimeters of visible length when flaccid, but it doesn't increase erect length and may cause instability during intercourse, along with risks of complications and scar tissue. Importantly, there are no permanent, approved methods for true penile lengthening endorsed by major medical bodies, such as Brazil's Federal Council of Medicine or most international organizations. It's also worth clarifying that penile implants, which are sometimes advertised online, are not designed for size enhancement. They're medical devices used to treat erectile dysfunction, and are only recommended in specific medical cases, not for cosmetic purposes. As we wrap up, I want to share a historical perspective that might reframe how you think about penis size. In ancient Greek culture, the ideal male body was often depicted with a smaller penis, which was seen as a sign of wisdom, self-control, and rationality. Large penises, on the other hand, were associated with barbarism, lack of discipline, or even comedic exaggeration. If you look at sculptures of Greek gods, heroes, or philosophers, you'll notice that oversized anatomy is rare. When large penises did appear in art, they were often part of caricatures or depictions of mythological figures like Priapus, a fertility god portrayed with grotesquely exaggerated features. This historical tidbit matters because it highlights how cultural ideas about masculinity and size shift over time. What's considered desirable in one era might be the opposite in another, suggesting that much of the anxiety people feel today is driven by social influences, rather than biological truth. If you've ever felt insecure or pressured by what you see online in media, or even in casual conversations, you're not alone. Hopefully, this exploration has put things into perspective. Penis size doesn't define your worth, your ability to connect with a partner, or your masculinity. What truly matters is your confidence, your respect for others, and your health, both physical and emotional. The scientific data shows that most men fall within a normal range, And the concerns that loom large in many minds are often amplified by unrealistic comparisons. If you found this information helpful, I encourage you to share it with others who might benefit from a science-based, judgment-free perspective. Thank you for taking the time to learn about this topic, and I hope it's left you feeling more informed and at ease. I'm Laura, and I'll see you next time.